This is blood sampling lecture. Blood sampling is one of the pre-analytical measures which are very important in affecting the result. As we say, the sample you send equals the result you get. Okay. These sampling are CLSI guidelines, meaning Clinical and Laboratory Standard Institute. The steps for blood sampling include the following. Test request, then you should identify the patient, prepare supplies, position of the patient, put your PPE, apply tourniquet, select the vein, clean the site, venipuncture, fill the tube in order, remove tourniquet, place gauze, remove the needle, dispose device, apply pressure, bandage, label the tube, handling, then immediate transport to the lab. All these steps should be followed for blood sampling. The first and very important step, you should identify the patient. As we know, we have two accepted unique identifiers in our hospital. The first is full 4 names and the ID number. You should use proper positive identification. You should involve the patient in the identification process. Ask him about his name. Inpatient and infant, you should also check the identification band. If there is outpatient infant, you should ask a family member. Check the patient name and identification with the request form. The request form must be identical to the patient identification you need. Prepare the patient. As a general rule, the best sample is what is known as basal state collection. Basal state collection, it is the preferable for all blood tests to be collected in the morning from 7 to 9 a.m. At this sample, fasting could easily last for 12 hours and only water is permitted. No coffee, no tea. In the morning of the sample, no cigarette smoking and no caffeine drinks. Okay. Preparing of the patient. Some tests need fasting as glucose. Glucose only 8 hours. If you prolong the period of fast, your liver start producing glycogen and changing it to glucose. It will not be an accurate result. Only 8 hours is needed for glucose. Also triglyceride, we need a fasting period which is more prolonged but only 12 hours. Physical activity. Physical activity affects the result of some tests. The patient needs to be at rest at least 15 minutes before sampling. Timing. Some tests, especially hormones, need a special time for withdrawal. As we know, female hormones, LH and FSH, should be taken at the second day of the cycle. However, progesterone at the 21st day of the cycle. Cortisol, which is what is known as circadian rhythm, it must be taken at 8 a.m. To continue preparation of the patient, we should talk about medication. If we are going to measure postprandial glucose, you should teach your patient that after taking the fasting sample, ask the patient to take a meal and therapy, oral or insulin-like routine. Don't just tell him to fast for 8 hours, then come and take the fasting sample and then take your meal and come for the postprandial sample. No, you should teach him to take his meal and then the therapy before taking the 2-hour postprandial sample. In case of drug monitoring, The patient to reach the steady state concentration should, in case of antibiotic, maybe he needs to take more than 3 samples. For drugs we can measure both what is known as the trough level and the peak level. The trough level is the sample of before the dose. The sample before the dose gives us an idea about the steady state concentration and if the drug we give reaching the concentration which is effective for the patient. However, peak level is the sample just after the dose. It tells us about toxicity. So, if we want to know about toxicity of the drug, we measure the peak level, which is the concentration of the drug in plasma just after the dose. However, if we wanted to know is the drug reaching the concentration which is effective for killing bacteria or effective for his mechanism of action, we should here measure the trough level as we will take the sample just before the dose. Okay. In measuring hormones as T3 and T4 and TSH, thyroid hormone, don't take the drug the morning of the sample as it affects the result. So if some of your patient is coming to follow the thyroid hormone level, she is taking the drug, okay, ask her to omit the dose of the morning before withdrawal of the sample. This will give you false high result and will not give you an idea about the level during the day. We need to make sure that T3 and T4 are at the appropriate level and they are controlling TSH at the lowest level. Okay. Prepare your equipment. Before withdrawal of the sample, you should prepare your equipment. Everything you need should be beside you and don't forget to take the request form. Position of the patient. Never take the sample from a standing patient. Some patient will have a vagal reflex and may just drop during withdrawal of the sample. No matter how healthy he is or how physical good he is or his physical state he is, he might be just drop like this. So never take the sample from a standing patient. Must sit on armchair and if necessary lie down, because he may faint. Don't change the position from lying down to sitting. This leads what we call as a hemoconcentration process. If the patient is lying down, especially in patient, if the patient is lying down, don't ask her just to sit down. This movement makes hemoconcentration. It moves fluid outside the blood vessel and may increase our test result by 10%. As regard to hemoglobin, it may increase up to 15%. I want to make comment about this hemoglobin result. If your patient is just moving from lying down to sitting, and suppose her hemoglobin result is 10 milligram per deciliter, 10 gram per deciliter, so it may increase up to 1.5 gram per deciliter due to this wrong movement. If you take a sample, it may measure 11.5 instead of 10. Also, if your result is supposed to be 7 and it is the level of blood transfusion, it will read 8.2 and it will not be giving blood according to this result because this wrong movement. This wrong movement may increase hemoglobin up to 1.5 gram per deciliter just because you ask your patient to change the position from lying down to sitting. Only allow it from standing to sitting and from sitting to lying down and not the opposite. Okay, Some tests as adrenaline may increase up to 50% due to change of the position. So positioning of the patient is very, very important as it affects the result you will get. Tourniquet. A tourniquet should be applied 4 fingers above the puncture site to make vein visible. If too close, it may cause hematoma. It should not be applied more than 1 minute to avoid hemoconcentration and false increase in proteins and cells. If you apply the tourniquet for more than 1 minute, you will remove it and take rest for 2 minutes, then be applied. The patient can make a fist but not fist clenching. He might close his hand but not doing this fist clenching of opening and closing his hand. That will increase potassium, lactate, and decrease ionized calcium. Don't use tourniquet for lactate, ammonia, albumin, and calcium. These are highly affected by the tourniquet application. Select the vein. Selection of the vein, you should take your time before selection of the vein, but as it is affect the quality of the sample and affect also the patient satisfaction. If you choose a very small vein and you try and retry, this will make your patient upset. The best sites are median cubital vein, cephalic vein, and basilic vein. Never take blood from the arm on the side of mastectomy. If you have a patient with mastectomy operation, don't take your blood sample from the arm on this side, because it will be there will be more lymph and more affection of the result. From edematous area, from area with hematoma, arm in which the blood is transfused, arm with vistula or vascular graft. Don't take the sample from sites above the intravenous cannula. If you are obliged to take the sample from the arm with intravenous cannula, make sure you are taking the sample below the cannula, not above the cannula. Here are some pictures showing us this an edematous hand. This is the arm close to the side of mastectomy. This is an arm with scar, and this arm with intravenous cannula. All these parts don't take the sample from these sites. When to take the sample from cannula? Use it if newly inserted for the first time. If you have just inserted the cannula, you can take the sample from it. If the cannula is the only available size, you have no other site, but you have conditions here should be followed. Shut off the flow for 3 minutes and report this in the patient chart. Draw 5 to 10 milliliter of blood and discard them before taking the sample. It should be not done for neonate. All their blood is only 100 milliliter per kilogram. Don't discard 10 milliliter of their blood. Clean the site. Use only 70% ethyl alcohol in the proper technique from the center in a circular manner outward. Wait 30 seconds to air dry. Don't just apply the alcohol and then withdraw the sample. Why we will wait 30 seconds? To allow the antiseptic effect, to prevent the hemolysis of RBCs during withdrawal, to prevent the burning sensation during venipuncture. Iodine affects the results of chemistry, and don't try to clean your site by using alcohol followed by iodine. This is done only for blood culture, not for routine culture. Iodine affects the result of chemistry. Don't touch the site after cleaning. Fill the tubes in order. When you withdraw blood for many test results, we have to put them in tube in order. The first tube to fill is the blood culture. The blood culture tube should be withdrawn under complete aseptic process. Then you will start with the tube for coagulation, it is the citrate tube, followed by the serum tube, the CBC tube, and at last the fluoride tube or gray tube. So you will start with blood culture tube, then the coagulation, chemistry, CBC, and at last fluoride tube if you need. Okay, every tube should be mixed. As a general rule, mix by inverting the tube and the wrist and the movement from the wrist. You will hold the tube like this and invert it slightly in a smooth movement from the wrist like this. As a general, all tubes needs mixing from 8 to 10 times, except coagulation tubes, only 4 times. So mixing needed for 8 to 10 times, except for the citrate tube and coagulation tube, only 4 time inversion. As for serum tubes, they are needed to be coagulated. It may take 5 times of inversion. So even blood culture needs to be inverted for 8 to 10 times. Label of the tube. You will label the tube after taking the sample, but at the site of collection. Never take the sample to the counter outside the room and start labeling them. No, you will take the sample and label them at the site of collection. Label contains the full name, ID of the patient, and also the time of drawing and name of phlebotomist. Here we have OSIS system and which identifies the point to be printed on the label. Handling and transport. Some samples need special handling before transport to the lab. As we know, ABG, ammonia and lactate need chilling. It must be put in ice. Protect from light as bilirubin. During the transport, you should put it in a leak-proof plastic bag, which is our biohazard bag, in an closed container, and transport to the lab immediately. Thank you.
That's all the class. Thank you. Assalamualaikum. I'm Mama Lynn Ansong, Medication Safety Officer of Pharmacy Department in Maternity and Pediatric Hospital in Hail. Today, I'm going to discuss about proper reporting of medication error. So, the purpose is to provide method for the documentation of all medication errors in a manner that allows reviewing the types and causes with the aim of preventing or minimizing the events. Medication errors have significant implications on patient safety. Error detection through an active management and effective reporting system discloses medication errors and encourages safe practices. So, these are the objectives on how on proper reporting of medication error. The objectives are define medication errors and classify their significance. Understand the extent of medication errors and their impact on patient care. Discuss the medication error. Discuss the many factors that contribute to errors and the impulse to place blame on healthcare workers. Medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of healthcare professional or patients or consumers. There are types of medication error. These are the near misses, circumstances or events that the capacity to cause medication error and include the process variation that did not affect an outcome but for which an recurrence carries a significant chance of a serious adverse outcome. Hazardous situations, circumstances in which people, property of the environment are exposed to one or more hazards. Causes of medication error. Clinical information missing like laboratory result and vital signs. Drug information missing. Miscommunication of drug order like eligible, ambiguous, or incomplete. Look-alike and sound-alike medication problem. Drug name, label, filling and package problem. Drug storage or delivery problem. Drug delivery device problem. Environmental staffing and deficiency and workload. Patient education problem. And last is independent double-check system. These are the causes of medication error. Sorry. The role of pharmacists in medication safety are: medication safety is the fundamental response of all members of profession of pharmacy. Pharmacists, as medication safety leaders, should have professional training skills and ability and has knowledge of medication use process. Medication error classification, types of error, prescribing, transcription and entering process, dispensing, administration, and monitoring. Prescribing and incorrect drug product selection. Transcription, any deviation in transcribing medication order from the previous step. Dispensing, any unintended deviation from an interpretable written prescription or medication order, including content and labeling errors. Administration, any deviation from prescribed medication order as written on the patient's chart. Monitoring, failure to review a prescribed regimen for appropriateness and detection of problems, or failure to use appropriate clinical data or laboratory data for adequate assessment of patient response to prescribed therapy. Outcome of medication error severity. A. Circumstances or events with capacity to cause error. B. Error occurred but did not reach the patient. It is near miss. C. Error occurred but did not cause harm. Error no harm. D. Error reached the patient and required monitoring to determine lack of harm. E. Error reached the patient and result temporary harm and required intervention. F. Error reached the patient and result permanent harm. Letter G is error reached the patient and required intervention to sustain the patient's life. Error and harm. Error reached the patient, letter H, error reached the patient and contributed to the patient's death. Example of dispensing error. A physician writes an order for primidone for a 12-year-old boy with a seizure disorder. Misreading the physician handwriting, the pharmacist mistakenly fills order with prednisolone for 4 months. The boy received prednisolone along with his seizure medication causing steroid-induced diabetes mellitus. The DM goes unrecognized and he died from death ketoacidosis. because the drug look alike and sound alike drug that lead to dispensing error. Example of administration error. A critical care nurse tries to catch up with her morning medication. After a patient's condition changes and required several procedures, he is intubated, so she decided to crush the pills and instill them into his nasogastric tube. She fails to notice the "Do Not Crush" warning on the electronic medication administration record. She crushes an extended-release calcium channel blocker and administered through NGT. An hour later, the patient heart rate slow to asystole, and he died because of administration error. So these are the steps on proper medication safety reporting. If any caregiver observing or involving or discovering medication error, he or she shall attend to the victim, that is patient and visitor or hospital employee, and etc., and call for help as needed. The caregiver should notify his or her supervisor or departmental director or head as soon as possible after the occurrence of discovery of the medication error, and if the occurrence is severe, take immediate action. Number 3, the attending physician must be notified immediately to take action. Number 4, the immediate supervisor must be notified to assess the outcome and to take action. Number 5, the patient shall be monitored for unwanted side effects. Number 6, documenting the medication errors. The individual discovering the error must initiate the documentation of the medication error using the medication error reporting form. If he or she do not document, his or her immediate supervisor should ask her to document it. The following information of the medication error report must be documented by the individual discovering the error are: patient's information, date of error occurred, date and time error reported, diagnosis, drug name, dosage, form and strength, error criteria or types of error, brief description of error, how event is discovered, is it used by the patient or not, outcome of the patient who initiated the error, who reported the error, was the error repeated, cause of the error, contributing factors, action taken for resolutions, interventions if needed, and recommendation to suggest on how to prevent recurrence of the error. Number 7, the completed medication error report form should be delivered to the medication safety officer in the pharmacy. The medication safety officer is responsible to keep all the original completed medication error reporting form in confidential manner. The medication officer must be responded to any employer asking photocopying any medication error reports to prevent using it against any provider for disciplinary action. The medication safety officer is responsible to aggregate the data of all medication errors and formulate a monthly medication errors summary report. Number 10, the director of the pharmacy or designee shall review all monthly medication errors summary report. Okay. So that's all. this would end my discussion about the proper medication proper medication safety reporting. Thank you.
Good morning, or whatever the time you receive this video. Today we will discuss the previous possible questions which obtain low score or not meet or partially met scores. But before we will proceed, I will inform you that possible questions was already sent through department emails, and I hope that everybody have it. And it was divided into two parts. First, part 1 is about essential safety requirement standards. Well, the part 2 is other questions but still related to SIBAHI accreditation process. So tips in this incoming survey, besides from possible questions that is being sent to you, you need also to read and familiarize policy and procedures present in your unit. And another tips is about answering questions to SIBAHI surveyors. Remember that they are well trained and experienced about accreditation process, so do not try to outsmart them or answering questions in a clever way. They are not out to find mistakes or catch us, but they are coming here to seek evidence of compliance to elements of performance. So they will evaluate us in 3 ways. First is document review, second is staff interview, and the third one is observation. So I hope that this guide us in the incoming survey, which might be after month of Ramadan. Okay, so the following questions are, okay, first, how are patients accepted to admission or outpatient care at maternity and children's hospital, and what are the eligibility criteria? This question will be asked not only in emergency room or outpatient area, but this is also applicable to every department. So you need to know what are the admission criteria in your unit. So the answer is based on patients' identified needs, maternity and children's hospital mission and resources, and our acceptance for care is criteria based. So please refer to acceptance of care and admission policy. Second is there any type of patient that you would not admit? The answer is patient whose identified needs that cannot be met due to unavailability of resources and beyond our scope of service. So again, you need to read the admission policy criteria. Next is how are patients prioritized for care at emergency department. So here we are prioritizing our patient into, first is emergent, second is urgent, and the third is immediate. So here again you need to try to familiarize the triage policy in emergency room. There are cases under emergent and there are also cases under urgent. So please read, and you can find it out in your triage form, I think. So for what is information, what information is provided to the patients and families upon admission to maternity and children's hospital? So our answer is patient and families are provided information on proposed care, expected outcome, and any expected cost to the patient for care. Number 5, how are patients managed in emergency department when there is no bed available on the discharge service or unit or elsewhere? So here, we got partially met. Maybe there is something lacking on the answer. So the exact answer is patient, if there's no vacant bed in the hospital for emergency case, patients are held at the observation room and treatment in emergency department until a bed is available, or do not forget that transfer the patient to another institution but after stabilizing the patient. Maybe this is the one lacking. Stabilize the patient first before you can transfer to another institution. So number 6, what are the follow-up instructions given to the patient or family upon discharge to ensure safety and continuity of care? So your answer will be patients and family should be provided with the following instructions: any return for follow-up care, when to obtain urgent care, so instructions for care as necessary to the patient's condition. So refer your discharge summary. Number 7, what is your role in providing patient-family education? So your answer will be giving appropriate information about illness and possible complications, hand washing technique, treatment and possible surgical procedures, use of equipment, inform not to connect or disconnect devices or infusions, pre-operative preparations and post-operative care, proper use of post-operative medications, X-ray procedures, dietary restrictions, when to seek medical assistance, and follow-up appointment. You say this one, make sure that all of this information will be present in your patient and family education form. Because even if you can give all this information, but there's no evidence that all of these things was found in the patient and family education form, still we can get partially meet or not meet score. Number 8, when are your patient's learning needs assessed? So learning needs are assessed as part of admission assessment and each time the patient's condition or needs change. Okay, number 9, how are patients at risk for falls and identified? So the answer will be all patients are to be assessed at their risk of falling on admission using the Morse fall scale form, transfer in, with change in condition, and a post a fall using what I said, the Morse fall scale assessment form. So if the patient fall down or already in the institution, you need to assist the patient every shift. Okay, so what are the strategies if the patient has history or fall down? Adult patients admitted as at risk are having a visual cue on the patient's beds or chart. So if upon assessment the patient has history of fall, you need to put the visual cue a triangle facing upward. Okay, but this one, okay? But if the patient fall down already, you need to position the visual cue, the triangle facing downward. So it means patient fall down already. Okay, this is the cue. Next strategy is take action to decrease or eliminate any identified risks. Number 10, what's the process for ordering and monitoring restraints? So the answer is, before putting any restraints, there is already written order from the physician. Then the order must be renewed every 12 hours. Another is, nurses should monitor the patients every hour for any blood circulation issues related to restraint. And the restraint must be released every 2 hours for 15 minutes when the situation permits. So again, refer your restraint policy and procedures. Okay, number 11, what are the 5 major types of nursing care delivery system? Anyway, this is not the question. This question was asked in nursing administration, and the question was asked, what type of nursing care delivery system you are using in the organization. So we are using the total patient care. So but here I give you the 5 major types of nursing care delivery system, which are total patient care, functional nursing. In total patient care, you will provide care to your patient. Total care, all care will be given to your patient on the entire shift. Okay. While functional nursing, the responsible nurse will have an assigned task to do function. Like for example, vital signs. So for the whole shift, you will only do vital signs. Or for example, medication nurse. So for the whole shift, you will only do the medication work. So other one is team or modular nursing. In this type of care, you are having team leader. Okay, but this one not applicable for us. This is applicable in the hospital, which there is nursing 1, nursing 2, or there is LPN or RN. So here there is a team leader, and the task will be assigned according to steps. Basic one will be given to licensed practice nurse, and the complicated work will be given to a registered nurse. It should act like that. While the primary nursing is you will assume total responsibility of the patients 24 hours even if you are no longer in the institution. So you need only to collaborate your care. While the case management, actually this one, nurse will not handling any patient, but you are only supervising the type of care or the care given to a certain patient. So in case management, more on supervising. Next is, this question was asked in operating room that got not met score. Procedure that are exempted from counting process. So although this is not applicable to us, but we should know that these 2 procedures are exempted for counting of instruments or counting of any sponges One is cataract surgery and other is cystoscopy. Okay, next is, again, it was asked in operating room, what is fire triangle? Okay, fire triangle, this is the three components needed to ignite and sustain a fire. So the answer are, one is oxidizers. Example of your oxidizers is oxygen. Okay, so this oxygen, it will support combustion if it will exposed to heat. Okay, another one is ignition source. So ignition source like flames, like static, what is this, electricity, or this is flames or static or electricity. There is something
Like in coterie.
yeah, coterie machine. Okay, like coterie machine. Next is third is fuel. Okay, fuel like gas, oil. Those are examples of fuel. Okay, number 14, how are patients approaching the end of life cared for? So the question here is nursing care provided to dying patients. Okay, so the care we are providing is palliative care. Okay, palliative care, this is a type of care provided to a person who with a terminal condition or incurable condition, or all hopeless cases, dying patients. So we are giving palliative care. We are treating only the symptoms, not the disease, in order to improve the quality of life. Okay, next, how do you deal with patients that deteriorated in the wards? Again, you need to familiarize the list of conditions under rapid response code. Now, how to activate the rapid response team? There are cases like seizures, bleeding. There is sudden changes in patient vital signs, sudden deterioration of the patient. You need to activate rapid response team. Next is, what is pre-flow protection IV pump? This was asked in neonatal intensive care unit. Pre-flow protection IV pump, or what is pre-flow protection, means it is a smart device which prevents against unintentional over-delivery of solution or medication by occluding the pumping tube when the tube becomes disengaged from the pump. So here we don't have any pre-flow protection IV pump. So what we did, we put measures. So for non-pre-flow protection IV pump, what you will do, we will put reminders attached on each pump to close roller clamps before disengaging IV tubings in order to prevent overflow or unintentional flow of fluids or medications. Okay, number 17, hospital intervention to prevent catheter misconnection. So the answer is, we need to inform the patient and families not to connect or disconnect any devices for infusions. Then next is all lines, tubes, or catheters are always traced from the patient to the point of origin upon the patient arrival to the new setting or service as part of handover process. Okay. Next is standardization of line reconciliation process. Okay, next is, I think this comment was in intensive care unit. There is a document evidence of handover between nurses or change of shift between intensive care nurse and the unit ward nurse at the time of transfer to a lower acuity of care. So from intensive care unit to ward. Okay, they need proof of hand-off communication technique. The ISBAR, you need to do hand-off communication. You need to do in-between endorsement using ISBAR method. So as we know, we need to introduce ourselves, identify yourself, your name and location. This one applicable especially if you are calling. Okay, you will call first before you will transfer the patient to ward. You need to identify yourself. Next, if you are already in the situation giving the endorsement, you need to tell the situation. The situation, give the patient age, gender, what is the patient status at present. Next is background. Give the relevant details such as presenting problems and clinical history. What is the clinical history of the patient you are endorsing? And next is your assessment. Put all together the current conditions, risk, and needs. And what is your assessment? Okay, so this includes vital signs. The present vital signs, which includes BP, your temp, and the most important one is your oxygen saturation. Then next is recommendation or request. Be clear of what you are requesting, or either review, treatment, or when it should be happen. Next is what is line tube reconciliation. Okay, this was asked in neonatal intensive care unit. So line tube reconciliation is tracing all the lines, tubes, or catheters from the patient to the point of origin before connecting any device, medication, administration, or infusion. Okay, next is what is an indicator? This question was asked to managerial department. No, it was asked to one of the staff in nursing administration. Indicator is a quantitative measurement that is rate-based, numerator and denominator, and is trended over time for comparison to standards, benchmarks, and used for quality improvement projects. So, if we will tell quantitative, so we will measure our data by numbers. So, we need to use numerator and denominator in order to find out the rate. That's the time we will compare our performance to other institutions. Okay, so what are the uses to track improvement activities? Based on this indicator, we will know if we are having improvement in our performance. Next is to measure day-to-day operation. Based on this indicator, we will know what is our standard regarding performance. Next, to provide strategic directions based on this indicator, this is our basis for improvement and to find out strategies in order to improve a certain process. Then, to compare performance to an established norm by benchmarking means this indicator you can use to compare to another organization which are established one. Who are the established organization? Those organizations that already passed accreditation. And if you will find out that your performance is below the standard practice, you need to adopt their system in order to improve your own organization. Okay, next is to reflect achievement to positive outcomes. Based on this indicator, you will determine if you achieve your plan to improve the process or no. Okay, number 21 is please explain the procedure to the line of line reconciliation. So here it was this question was asked in neonatal intensive care unit and we got a not met score. Okay, so step 1, using your hand, physically trace the line from the solution. So from here, you need to trace through the pump, ensuring correct cartridge placement down to the patient. Okay, and during the step 1 also, you need to verify fluids if it is correct, medications, if you are infusing medications, blood, or if you are administering blood and enteral products against the order. Okay, so you need to check the name of infusion, medication, the concentration, dose, and rate. Okay, step 2, you need to verify correct pump settings. Okay, so from tracing, starting on the tubings up, you need again to verify the pump settings. Correct pump's profile, concentration. Again, check also the patient weight for weight-based medications. Like for example, in NICU, we are giving fentanyl and calculating the dose, we need the patient's weight. And again, you need to calculate the dose and set your pumps according to the rate required. So step 3, now you need to verify that the connection is secured to the correct port. Okay, so for example, in NICU, if you have so many infusions and so many ports, you need to label it. Okay, you label it. This port is for IV fluids. This second port is for example, TPN, or the other port is for fentanyl, the other port is IV fluids. It should be like that. So perform this process for each infusion, even those run on pumps other than Alaris. So this ordinary pump or Alaris, you need to check. Alaris, this is type of infusion pump which will deliver large volume of fluids. In this one infusion pump, they can deliver 3 types of fluids. That is why it needs to be checked, because this type of infusion pump is hazardous because of a large volume can be transfused in one time. Okay, so that's all for the previous questions which obtained not met and partially met scores. So I hope that it will guide us in the incoming survey, which might be, as I said, after month of Ramadan. Thank you. Okay, so again, good day. Now we will discuss about material safety data sheets. in behalf of Engineer Abdulaziz El Bagawi, because this is supposedly his topic, I want to give clarification about material and safety data sheets. Okay, material safety data sheets is a document that contains all information about the chemical. Most important are: one is product identification, second is hazards identification, uses of chemicals, first aid measures, accidental release measures, spill management, handling, and storage. So anything in this important mission, anything of this will happen, you should always refer to your material safety data sheet in your unit, and it should be in each unit, and each chemical that you will have, it should have one appropriate material safety data sheet. Okay, so before we will proceed to, I will give one example of material data safety data sheet to one chemical. I will give you information about hazardous materials classification. Okay, so if you will see here, blue color is about health hazard. Okay, if a blue color will score 4, it means that chemicals is deadly. Okay, if it will score 3, it means it will cause extreme danger to your health. Score 2, it will cause hazardous to your health, and 1 is slightly hazardous to your health. While if score is 0, means normal. Okay, that chemicals will not cause hazard to your health. While in red portion, this is about fire hazard and plus points. Okay, so score 4 is below 73 Fahrenheit. Score 3 is below 100 Fahrenheit. Score 2 below 200 Fahrenheit. And score 1 is above 200 Fahrenheit. If score 0 means this chemical will not burn, okay, or will not cause fire. While the yellow portion is about instability, how stable this type of chemical. Okay, if the yellow areas, if your score is 4, it may donate. So donate it will explode. Okay, if yellow area score 3, it will shock and hit, may detonate. Okay, so detonate means it will explode. Next is, if it will score 2, it is violent chemical, it will cause violent chemical change. Okay, if that chemicals will expose to heat. Then score 1, unstable. Okay, and if it is score 0, it means the chemical is stable. While in the white portion, this is indication of specific hazard. If you will find OXY, which is, it means oxidizer, it means that chemicals will produce combustion if it will expose to another chemicals. acid, that chemicals is acidic or alkalinic for ALK, corrosive for COR. For W, then there is dust. You use the chemical without water. Or in firefighting, you cannot use water to put off the flame. Then there is also sign for radiation hazard. Okay, so now we will proceed to the example of material safety data sheet. Okay, this is example is about potassium permanganate powder. Okay, so if you will notice here, there is chemical product and company identification. Even the company who produce or distribute this potassium permanganate was present. In section 2, there is composition, information on the ingredients, and in section 3 is hazard identification. Okay, so in the emergency overview, this potassium permanganate will cause the following. So this is a strong oxidizer. Okay, so what you will do, if these chemicals will expose to more than 150 degrees heat, this will cause fire. It is these chemicals or this potassium permanganate powder will be harmful if it is swallowed, because it will cause severe respiratory tract infection with possible burns. And it may cause also severe digestive tract irritation with possible burns. It will cause also severe eye and skin irritation with possible burns. And the target organs are central nervous system, lungs, respiratory system, gastrointestinal system, eyes, and the skin. Okay, so here there is guide in case of potential health effects. If the chemical, in case it will contact to the eyes, you need to immediately flush your eyes with plenty of water for at least 15 minutes and get medical aid immediately. Okay. So for the skin, in case it will contact to the skin, immediately flush skin with plenty of water for at least 15 minutes while removing contaminated clothing and shoes. Get medical aid immediately. Wash clothing before reuse. And note, contaminated clothing may be a fire hazard. In case chemicals was ingested or if swallowed, do not induce vomiting. Get medical aid immediately. If victim is fully conscious, give a cup full of water. Never give anything by mouth to an unconscious patient. So there is exemption. A patient already unconscious, so do not give anything by mouth. If the chemicals is inhaled, remove the victim to fresh air. If not breathing, give artificial respiration. If breathing is difficult, give oxygen and get medical aid. So for guide for the physician, the treatment will be symptomatic. Okay, so in section 5, the firefighting measures. Okay, if in case of fire, this is what we will do. Wear a self-contaminated breathing apparatus and pressure demand. This one recommended by OSHA, and this OSHA is Occupational Safety and Health Administration. And also wear a full protective gear. What is not allowed is water runoff can cause environmental damage, like dike and collect water used to fight fire. So these chemicals cannot be disposed in dikes or because it will cause damage in the environment. Okay. What else? This potassium permanganate is a strong oxidizer. As I told you, if it is a strong oxidizer, it will cause flame if it is exposed to another non-compatible chemicals. Then contact with other material may cause fire. Some oxidizers also may react exclusively with hydrocarbons. So oxidizers, it depends on the chemicals. There is chemicals that can cause combustion or it will explode, and some it will act like explosive. So for extinguishing medial, use large quantities of water. Do not use dry chemicals, CO2, halon, or foams. So here you cannot use your carbon dioxide powder, fire extinguisher. Only you can use water. So NFA rating, NFA means National Fire Association. This is the rating. Instability, so this chemical is not stable, and she belongs to oxidizers. So these chemicals will cause combustion. So for general information, use proper personal protective equipment recommended by Occupational Safety and Health Administration. Okay, so now the NFA rating. Okay, what is the NFA rating of potassium permanganate powder? So, blue, no? In blue, which is health hazard, it scores 2, means this is hazardous to health. In red area, it scored 0. So these chemicals will not cause fire unless it will store more than 150 degrees heat. Okay. Then next is yellow, score 3. It will explode. Yeah, it will explode when exposed to heat. As I've told you, the stability is below 150 degrees. Then also she belongs as oxidizer. It means it will support combustion. Okay, so these are all about material safety data sheet. I hope that this information will change on everybody's concept and appreciate the importance of material safety data sheet in the unit, because this is your reference on appropriate measures in case of chemical hazards, mostly like health effects and as also chemical spills. But most of all, it will serve as your guide in preventing any such occurrence. Thank you.